the Trichological Society of London is one of the leading bodies on hair study in the world. It is the leading body in the world. And I went there to study the science of hair. And what got me very interested in it was that, hair has always had a social angle. Because if you see, long hair is considered beautiful. Judges, even in the UK, even nowadays, wear wigs to signify power and strength. So hair has always been important socially. But hair is also important emotionally, because people who are losing hair, studies have shown that they are less favorable for jobs, particularly sales and marketing. Studies have also shown that people who are losing hair have less sexual partners in the West and higher divorce rates. Studies in India have shown that men who are losing hair believe that they look at least 10 years older than their age, and they do suffer a lack of self-esteem because of it. So it's a social angle, it has an emotional angle. Very importantly, hair has a medical angle. And by looking at hair, if you're a trained trichologist, by looking at hair, you can diagnose so many underlying conditions. So you can look at a patient's hair and know whether the patient has PCOD, has thyroid, has anemia. So there is a lot that the hair can tell you about the inside health of a patient, which is very fascinating. And the last fascinating aspect of hair is the medico-legal aspect of hair. Because in the UK, when we study trichology, we are also taught about how hair can be used for medical jurisprudence. Just to give a simple example, that drugs can be tested in your blood for about a week, or a couple of weeks. But in the hair, they last for close to 9 months. So there's a lot that even medico-legally hair can help you, and that's what excited me, particularly with women. And because of low hemoglobin and low ferritin levels, women lose hair. I've been in practice from 2001. So for the last 23 years, my observation. The second is stress and lifestyle. I've added lifestyle to this as well. So stress gives rise to a hormone called cortisol, and that gives rise to hair fall. There's a particular type of hair loss where patients under stress even pull their hair out and start to eat it. It's because of anxiety and stress. So that's another very important thing. And lifestyle are things such as crash dieting, when we try to lose weight very quickly and we don't get the right nutrients. Hair is one of the fastest multiplying cells in the body, so it needs constant nutrition for it to grow. So if you're not eating correct, if you're eating the wrong kind of food, if your body is not absorbing food, if you're skipping meals, if you're on a very strong diet, you will lose hair. Smoking is another very important lifestyle contributory factor to hair loss, because with smoking, studies have shown that your blood vessels to your hair follicle starts shrinking, and the blood is what carries the nutrition to your hair. So with smaller and shrinking blood vessels, your hair follicles also don't get enough nutrition. So those are some of those common problems. Other medical conditions are thyroid and PCOS. Thyroid is a hormone which regulates a lot of functions in the body. With high thyroid or low thyroid, both you can get hair loss. So if your thyroid is overworking, you can get hair loss, and if your thyroid is also underworking, you can get hair loss. And in my experience, about 10 to 15% of patients who come have an underlying thyroid disorder. Final is PCOD, a very important ailment nowadays, because we find at least 20 to 25% of young girls having PCOD, and in this they lose hair, they get acne on the face, they get hair growth on the face, they put on weight, their periods become irregular. So these are some of the most common causes of hair loss. Of course, the big cause of hair loss is genetic, and up till now there was no treatment for genetic hair loss specifically aimed at it. Just some studies to show you what's happening in terms of India and hair loss, some trends. So if you look at this, the onset of male pattern baldness has now decreased to 21 years of age. When I started my practice in 2001, we used to get patients in their 40s, then it became 30s, then it became like 28, now 21-year-old children, or young adults, I'd rather say, have started losing hair. So it's a very, it's a fact. It's getting younger. The onset is getting much faster. 50% of men in India suffer from male pattern baldness. Male pattern baldness is a very common type of baldness where you lose hair from the top, but never from the back. Your hairline starts to recede, then you get a bald patch on your head, but this hair never goes. This always remains. So that is male pattern baldness. So 1 in 2 men in India suffer from this condition, and this is almost always because of a hereditary cause. And about 20-25% of women suffer from female pattern hair loss. These are some studies to show you that how the hair loss searches in India have gone up. I just have to move 21 lakhs. Thank you, that might help. Thank you. It's gone up from 6.4 lakhs to about 21 lakh, which is about 3.5 times. Very important is that, again, firstly, this is one of the only treatments for hereditary hair loss, and also targeted treating women, because women didn't have too many treatment options earlier. This is a very good option for women as well.
Here Dr. Batra in the Dubai Health City branch. Today I'm very excited to walk you through our revolutionary program, which is Exogen, a cutting-edge solution for hair rejuvenation. This procedure has 4 steps. Moving on to our first step, which is called oxygenation. In this step, we are providing the scalp with the pure oxygens, cleansing it thoroughly, opening the pores, and preparing it for the serum absorption. This whole step takes around 10 minutes. Moving on to our step 2, which is serum absorption at the derma pen. Here, we are going to take our serum specially formulated with exosomes and hair growth factors. It has 1,470 hair growth factors. Which helps the hair to stimulate the hair follicle and promote hair growth. We use a derma pen to gently infuse it into the scalp. Our derma pen allows the serum to penetrate deeply, stimulating the scalp and activating damaged hair cells. This whole step lasts for 20 to 30 minutes. Moving on to our third step, which is called electroporation. In this, we are going to use a warm probe to massage the scalp gently. This step helps us to push the serum deeply into the scalp. It's not only non-invasive procedure that causes no discomfort, yet it is one of the most effective methods. Moving on to our final step, which is cooling. Last 2 steps last for 10 minutes. Cooling helps to soothe the scalp, helping us to close the pores, leaving your scalp feeling refreshed and relaxed. This whole procedure is completed within 50 to 1 hour. Thank you.
Zoya, can you hear us? Hello, can you hear us, Zoya, Team Dubai? Okay, maybe my mic is not connected, but that was a live demo. You saw it's connected. Okay, can you hear me? Doesn't matter. Maybe I just wanted to show you that it's a live demo. What you saw was real live happening and not recorded. So that's how easy the process is, and that's how the patient comes in. The most important part of our treatment is the assessment.
Andriki Namaskar. My name is Dr. Akshay Batra. I am the Managing Director of Dr. Batra's clinic, which is India's largest homeopathy clinic with 200 clinics across 5 countries. I am also a trichologist, which is a specialized doctor of hair from London. And I have also been the president of the London Trichology Society. Today we are here to launch a very new treatment called Exogen. This is the latest treatment for all types of hair loss, but particularly for hereditary hair loss. In the market till today, there were no specific treatments aimed at treating hereditary hair loss, which is the largest cause of hair loss in India. 50% of men and about 25% of women suffer from hereditary hair loss. With Dr. Batra's Exogen treatment, this problem can now be addressed very scientifically and very effectively. This is a very easy treatment. The patient needs to come to our clinic for assessment. In assessment, our doctors will find out what is the cause of hair loss and then suggest the right treatment plan. With this treatment, we are seeing results in as less as 4 sessions, which is 1 session a week. So therefore, in 1 month of treatment, we are seeing very good results. Compared to any other treatment in the market, this is giving the fastest results. It is extremely easy for the patient. There's very little pain, discomfort as compared to any other treatment. So the results are fastest, and the results are pain-free, and the results are without any side effects. Now, these treatments basically have 1,470 growth factors. It is a targeted and precise treatment. So a serum is applied on the scalp in the clinic. That serum has very, very small cells which are 1,000 times smaller than any other cells in the body, so that they can penetrate the hair follicle and reach there and then start their action. So there is no wastage of medicine from application to hair follicle, which is one reason why this treatment is getting such good results, because there is no wastage of the effect of the medicine. Secondly, these 1,470 growth factors are at least 100 times more than any other available treatment in the market, and therefore the results are excellent. What these growth factors do is that they help in anti-aging of the hair follicle. So they send messages to the hair follicle to reactivate, so that the damaged and the dying hair follicles can start sprouting hair again. They also help in increasing the blood flow to the hair follicle, thereby allowing your natural body's nutrition to support this healing process. We are seeing about 91% results with this treatment, and we are very, very happy to launch it. It has 11 clinics in Bangalore, 14 clinics in Karnataka, 190 clinics in India, and 200 clinics overall. Apart from India, we are in UAE, we are in Bahrain, we are in Bangladesh. So these are the countries. If you take an appointment, if you are losing hair, please do consider coming to our doctors for an assessment. The assessment is the most important thing, because that's how we will know what is the real reason for your hair loss. Please remember that if you are losing hair, a parlor procedure or an online treatment or a home solution and remedy or an oil will not help, especially if you have an underlying medical condition, including hereditary hair loss, where the hormones in the body start affecting your hair. So for these, you need a scientific assessment and a scientific treatment, which we will provide for you. And once your assessment is done, the doctors, after looking at your type of hair loss, your grade of hair loss, your age, will then recommend the right treatment forward for you. And with this assessment and the right treatment, you will definitely get very good results. Thank you.